and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Now, global health is full of contradictions. New medical innovations are being developed faster than ever, but many remain unaffordable and inaccessible to the countries that need them the most. A newly launched alliance wants to change that. Its goal is ambitious: to build a global ecosystem where both diagnostics and therapeutics are not just affordable, but equitably distributed and developed. So today on the show, joining me to discuss this further is Dr. Sanjeev Krishna, who is a professor of Molecular Parasitology and Medicine at City St. George's, University of London. We also have Jean-Michel Piedagnel, who is the director of the South-South Diagnostics Alliance. Welcome to the show, gentlemen. Thank you so much for joining me. An exciting new alliance with a very long name, which I will attempt to say. So, International Affordable Diagnostics and Therapeutics Alliance. We shortened it to iData.
Well done, well done, Melissa.
Okay, so I'm just going to call it iData from now on. I'm curious to know what it is. Talk to me about the formation of this alliance and why you founded it, co-founded it.
No, thank you so much. Well, thank you for having us. That's you know, it's a real privilege to be able to discuss some of these ideas now. Malaysia is not new in leading in many innovations for South-South development. So, you know, actually Jean-Michel was part of the process of developing, for example, a new treatment which was for the first time affordable for hepatitis C, Remdesivir. And, you know, this has become, I think, a kind of beacon for how to do things in the global south. And, you know, and also within the framework of Madani, the Madani government's goals for equitable healthcare and allied to that systemic resilience within the area. So that's the kind of context that we're working in. And you mentioned at the start, Melissa, I mean, there are such exciting developments in medical science these days. But look at them, you know, CAR T-cell therapy, which treats leukemias, lymphomas, and so on, half a $1,000,000 a pop. Gene therapy is coming online now. You can actually cure genetic diseases, $2 million. So who can afford that in the global south? So really, we've come together, and this is like-minded people, so it's within an alliance, to see, you know, how can we subvert some of these issues and make healthcare really accessible and affordable where it's needed, so that no one gets left behind. And that's really the heart of what we're up to. And we're starting off in these two areas. One is on diagnostics, and the other is on new treatments. And we can discuss that in
okay. So very exciting.
But I think, Melissa, the one thing that Sanjeev forgot to mention, because it's obvious to us, but it's Malaysia. It's a Malaysian initiative. So it's an initiative from the global south, as we call it. So countries that are not seen traditionally as leading innovation, as leading research. And I think that has been the mistake. It is to underestimate a lot of the emerging countries, such as, I mean, Korea is a good example, of course China is a gigantic, India, but also Malaysia, Thailand and other countries which have a potential to innovate.
Right.
And so the problem is that innovation doesn't have any channel to be accessible and commercialized. So I think what we want to do is to create a channel for all this potential, all this innovation that exists in, you know, what we call the global south, all these countries which we are not usually seen as active in innovation.
So I want to ask about what the gaps are, what it's trying to address, what this alliance is trying to address in that maybe other global health institutions, existing global health institutions, haven't addressed at the moment.
Could I jump in?
Sure, of course.
Because, you know, that's the heart of the matter. So long, we've been responding to other people's priorities. You know, we think we need to solve this problem for you, or we think, you know, you should look at this maybe. What we're trying to do is to work in a needs-driven way. So let me give you a concrete example. I had the privilege October last year of working with Professor To in Sarawak which is one of the more inaccessed areas in Malaysia. And we also went with a Chinese company. And we went up country, we went up to Kapit, and we talked to healthcare workers en route. We went up there and we said, look, what do you folks need? And they said, we need diagnostics, really.
Okay.
We need diagnostics which we can use here. Dengue, big problem. Also monkey malaria, also one or two other diseases. And we turned to the Chinese technology innovators who are our partners, and we said, well, what do you think? Can we do something here which is accessible and affordable? And they said, yes, we can certainly try. And we can even go one step further. We can try and make a diagnostic test for all 4 of these in one go. So you see, the principle, and Jean-Michel has already emphasized this, and it's critical, is it's needs driven by what we find in the region. And we're not just talking about Sarawak, for example, but ASEAN in general.
When you mentioned those neglected diseases, right? Dengue, monkey malaria. Jean-Michel, you've spent years working on neglected diseases. From your vantage point, how do you define neglect in terms of diagnostics and therapeutics? And I'm just wondering, if I may put it this way, who is doing the neglecting?
You know, I will respond as someone who has been actively engaged in access to treatment and diagnostic for neglected tropical disease. I think there are more and more neglected diseases because there are more and more diseases where pharmaceutical companies cannot make huge profit. And that comes back to the problem of the current system, which is a very high profit. I've got nothing against profit. My parents were shopkeepers, so I come from a very, commercial background. Yes. But huge profit, the kind of profit that the pharmaceutical companies make, a small group of corporation that is driving the whole research system and the whole marketing system. So this is what we say, innovation is not the issue. Cost is the issue. I often make an analogy which seems to resonate with people. If we look at the Ukraine-Russian conflict, follow me on this. Which drone is the big innovation in, if we can call this like that, in the Russian-Ukraine conflict? What the global north, the West, can produce is very expensive, very smart, very innovative drones, which are also usually expensive. And we can't dispute that those drones are amazing and probably have a use in the context of war. I'm not a war specialist. But what does Ukraine and Russia use every day? They use small, cheap drones. And that the global north cannot produce. It's China, or now they are producing themselves. And so this gap that we see in the context of the drone is the same gap in the context, for example, of diagnostics. There are amazing diagnostics which are out there. As we said, innovation is not the issue, but they are hugely expensive because this is what the current model provides for. This very expensive equipment that will be available in a few hospitals, but not available, in Borneo, in a remote area. Okay. So what we want to do is to use the potential of endemic countries and countries that have those neglected diseases and develop a pathway so that the product they have can access patients.
Right. Do you think diagnostics has been or gets less visibility than therapeutics? I think a lot of us are familiar with the issue of access to medicines, that people in the global south often can't afford or don't have access to the drugs that they need. But diagnostics are just as important, right? Because if you don't get an accurate diagnosis, you probably won't get the drugs you need, you might not get the right treatment, it might come too late. Do you think that it is, there's an imbalance there?
That's such a critical question, Melissa, because it's only on the basis of a diagnostic that more expensive products are then used. And the use of interventions, drugs, surgery, whatever, depends on having an accurate diagnosis in the first place. But here's the rub. Why is the driver, what are the drivers for developing new products like drugs compared to diagnostics? And of course, if you look, shareholders value you know, the costs recovered from diagnostics and the markets are smaller in terms of value compared to drugs. So we have this imbalance, and so people don't tend to focus on, in fact, they focus even less on diagnostics for neglected diseases than on perhaps even developing new treatments for neglected diseases. And yet the two go hand in hand. You need one for the other.
If you have a treatment without diagnostic, you probably will miss part of the treatment pathway. And so, because there is no research for treatment, why should there be research for diagnostic? And that's, you know, we need to break that cycle. And so we are starting with diagnostic because it is an easier approach. It's easier to do than developing new treatments, especially new chemical entities. We should not underestimate the effort, the cost, the knowledge that is
how
needed.
long it'll take,
but we will hit at some point if we develop, we are now starting to work on dengue, if we have a good diagnostic on dengue, and if we can bring people to the health center quicker, if there is no treatment, then people will stop using those diagnostics. You know,
so we have an answer also for this question of expensive drugs.
Yes.
You see, COVID, I think we've been taking drugs and using them in a repurposed way for over 100 years. I mean, look at aspirin. But it was COVID-19 that showed that when you're working under pressure and you want to get impact on people's health, you can take a drug, like, for example, the steroid dexamethasone, and repurpose it, you see?
Yes.
So that's the approach that IA Data is also developing now for managing some conditions which are also becoming highly neglected in ASEAN and the Global South. For example, cancers. They're not affordable to treat.
Repurposing drugs for cancer care?
For example, for cancer care. So this is part of the program. In fact, we've literally, this month, we're starting clinical trials here in Malaysia on using a Chinese discovery originally, an anti-malarial. So it's very affordable.
For what kind of cancer?
Well, we're studying at the moment one precancerous condition, which is cervical precancer caused by infection with HPV. But we're also working on colorectal cancer, where we've had some very exciting but very preliminary data.
It's important in Malaysia because of
very
high
important.
Here. Yeah.
But let's come back. So in other words, you know, Jean-Michel was completely correct. You can't have just a diagnostic without having a solution that the diagnostic, you know, then says we need to have. So we're working on those aspects as well. It's
so
like
it has to come in hand in hand.
Hand in hand.
What is then iData doing for this? Is it funding new test kits? Is it building new manufacturing capacity? How do you come in?
It's all of the. Okay. So iData is embodying the Madani government goals, you know, and actually Prime Minister's recent Shangri-La speech on, you know, cooperation, not coercion. So what we're trying to do is to, you know, embody that cooperation, the collaborative side of needs-driven research by bringing together government resources. You've got the Ministry of Health, Ministry of Higher Education. You've got the, you know, IMR, ICR, the Institute of Clinical Research, Institute of Medical Research, all these wonderful institutions. University of Malaya as a center of excellence for drug repurposing. Bringing all this together with civil society, with product development partnerships that Jean-Michel is leading, with academia I've mentioned, and with industry. Because you can't do anything without having people to actually deliver the products. You've got to have the products in hand.
So I think what we want to see happening with iData is the consolidation of knowledge through an expertise center, knowledge that already exists. There are gaps, but they are not that difficult to fill in. This is why a partnership with a university like City St. George is useful. So you create an expertise center in Malaysia, around essentially. And then with the South-South Diagnostic Alliance, you collaborate with other countries in the Global South who share the same agenda. as you are. So, for example, on dengue, we are already working with Thailand, Vietnam, Sri Lanka, and Brazil. So that's what we call the South-South collaboration.
Wonderful. Can you talk to me a little bit about what you both see as the most promising avenues to pursue? So I understand this alliance is brand new. It's still a baby, still an infant in many ways, but there's a vision here. And so what is taking priority in terms of where you see the most promise that can help democratize access and affordability to diagnostics and therapeutics?
Well, Jean-Michel is spearheading on the diagnostic side, and you know, we've mentioned dengue. Wherever you look, dengue and related viruses are becoming a huge problem, whether it's in Brazil, in Sri Lanka, or in so many countries in ASEAN. But look at the UK. Just last week, mosquitoes carrying the West Nile virus were discovered for the first time in the UK.
Wow.
So these are not problems that are going to be...
climate change, isn't it?
All these issues are happening more and more and more. So diagnostics, and especially for diseases which people look away from or don't bother to help, you know, that's one area. But I think... and it's a longer term challenge, because whenever you're working on delivering new ways to treat, it takes, you know, it takes a longer process, because you've got to do the right level of science. So scientific excellence delivered through new treatments, new diagnostics, but overarching all this is, of course, bringing the best ideas through international alliances, working with leading industries so that their technologies you know, can be applied with one shared goal, which is, you know, access, affordability.
So I think for the South-South Diagnostic Alliance, which is the more global collaboration arm of IADATA, we're looking at collaboration on a scientific level, but also collaboration on an industrial level. So collaboration on a scientific level, the usual scheme of development innovation is, you know, the global north, Western countries, Europe, US, are at the center of it. And so you go from a south-based country to the global north, and from the global north to another south-based country. So we want to get research centers, research organization, public, especially public research organization in the global south to work together.
Are you cutting out the global north? Is
no,
that,
we are
is
just...
that the idea, or is that even feasible?
No. One, you see?
Yes, I can see the reaction.
Not at all.
City St. George is here. The global north, and I can say that because I'm French, so the global north in the research environment acts too much as a gatekeeper.
Gatekeeper, okay.
You see?
Yeah.
So you have to be vetted by, even on dengue, which is a disease that doesn't exist in the global north, you always have to be vetted by an older French guy, for example, just to, like me. So we want to, we say why. The question is why. Why is, you know, I have some great colleagues on dengue, Professor Panisade in Thailand, Professor Nelika in Sri Lanka, Dr. Amy, who's the head of IMR here. All these people have a competence. Why do they need an older Frenchman or an older English guy to vet what they are saying? In fact, they have more knowledge here. So the idea is that let the knowledge between those groups flow. So that's the first thing, scientific collaboration. And then when you look at the industrial potential, the innovation potential, you suddenly realize there's a lot of small companies that come with really brilliant ideas, but they cannot get through that system because that system is biased. It's got a very, very high entry cost. If you want to get into the global health system is very expensive. And then you've got standards, you've got regulations, but those standards, those regulations apply mostly to the US or to Europe.
Okay.
And the question is, why do you need to use standards from a foreign country when you want to deliver a product in Malaysia or in Thailand or in Sri Lanka? Those countries, actually Malaysia has a very, very good regulatory authority. I've worked with them, they are very competent, they know what they are doing, they are certified left, right and center according to global standard. They can review a product, and they can tell us whether that product is safe.
Okay.
And that is much cheaper.
So Jean-Michel, you know, Jean-Michel has put it so well. Malaysia is now, the government, I think, the approach is not just reforming healthcare thinking, but it's actually redefining it in a different way. So, you know, Malaysia can become the fulcrum for bringing together these innovations. And you've got, you know, Professor Ivy Chung at University Malaya. She's a focus of an accelerator to bring together industrial technologies that are ready to be applied and the disease expertise, which is so essential if you're going to deliver the technologies for those diseases. You see, so you've got that confluence now, and you've got BRICS, you've got ASEAN. It's actually quite an exciting time.
I'm sensing it, but just to maybe manage some of the hype, because we have seen other global health initiatives come and go. Some have succeeded, some have stalled.
Yes.
What do you think would be common traps that new alliances fall into, and what IA data should avoid, or to make sure that you sustain this momentum and get to see this vision that we have?
It's not going to be easy. And one of the reasons it's not going to be easy is people are used to work in a certain manner. Okay. And we are challenging that status quo. So for example, you can still have Malaysians or Thai, it doesn't matter, the country doesn't matter in that, working in the Ministry of Health. When you come with a Malaysian or a Thai innovation, they said, oh, has it been used in the US?
That's the
so
mindset
I think this
also.
kind of mentality, which is directly inherited from, I think, you know, colonial
times,
time, we need to shift. We need people to realize that today Malaysia is a net contributor to innovation, and we need to support that. And why do I say that? Because I think this is one of the ways we can really improve access, which is something I've been fighting for the last 30 years. You know, it's not going to come from us in the global north, because we are used to building very expensive tools, drugs, machines. So they always end up registered in the country and available in the pharmacy or in the hospital at a high cost.
Right.
I grew up in the global south, actually. I grew up in Tanzania. So I really understand from a very early age, where both my parents were doctors. So I saw the problems there. And I can see also that, just to answer your question, Melisa, you know, what are the risks, what are the downsides, what are the hazards?
How do we keep the momentum going? Yeah.
We are always going to come across, this is a shapeshifter, okay? But we're always going to come across vested interests. Whether it's vested interests at a global scale, or whether it's vested interests locally, wherever you're trying to achieve an impact. And I think our job in IA Data is to be as open as we can be, as cooperative as we can be to try and address these vested interests, but I think not subject to coercion. So this is what PM was saying, right? Cooperation, not coercion. And I think this is one way to look at the whole subject.
I think previously the kind of cooperation that has been offered from the global north is, how do you call it? What's the
coercion.
Word? Coercion.
Yes.
So it's like we have a great idea for a partnership.
Right.
We tell you what to do and you do it.
Yes.
And we need to change that, because knowledge, you know, when you speak about a disease like dengue, the knowledge is here. In Malaysia, in Thailand, in Sri Lanka, in Brazil, in Indonesia, not in Europe, not in the US. Some knowledge is in Europe and in the US. And that knowledge is very useful, because we cannot deny that there is really immense potential also of knowledge and innovation in the global north. But that knowledge has to support the initiatives that are led from endemic countries, not the other way around.
And knowledge by itself doesn't have the same strength, doesn't have the same force as experience with knowledge. And experience is not there. So our Chinese colleagues, technologists who are innovating these tests, they don't have much dengue. So they're very happy to share the experience that is already here in Malaysia as an excellent center, to develop the best product for the problem. So you have to have that cooperation between experience, knowledge, and then of course the drivers and the ability to implement, the ideas, to do the right
Well,
tests.
that's what iData is
Exactly.
for.
Exactly.
And on that note, I want to thank you so much for being here and telling us about this new alliance. And hopefully in a few years' time, we'll come back and do this interview again, and you can tell me all about the successes you've had in making diagnostics and therapeutics.
Maybe not a few years, I hope.
Hopefully not a few
Faster!
years.
Oh, hopefully by the end of the year.
By the end of this year.
We're
Okay.
optimistic. Thank you so much,
Thank you.
gentlemen.
Thank you.
Thank you.
Thank you.
That's all the time we have for you on this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching. Good night.